This time of the year, you know, if you're not sick now, well, hang around a few weeks and you will be. Everyone seems to come down with something during the colder, busier months. And in today's health break, we will see why choosing the right form of care can be as simple as choosing the right type of doctor.
The change in seasons and the start of the holiday season introduces another, less welcome one.
We're certainly in respiratory season, right? We're seeing all the normal viruses, so RSV, flu, COVID.
Which usually means they're also seeing crowds at urgent care centers. But that's not always the best first stop when it is kids who are sick.
We really find that we get the best care when we have, like, a comprehensive, continuity there. It's really challenging if it's fragmented and broken up.
South Coast Health pediatrician Dr. Nelson Elam says with the exception of emergency situations, a pediatric office is the place to start with children's care.
There may be times when urgent care is appropriate, but I think it's always best to call the office, and even if we're not open, we have a triage system and they can help determine, yes, that needs to be seen right away, go ahead, or you know what, that actually could be seen tomorrow, let's make you an appointment, or, coordinate the care. Even if they're out of town, we tell people to just call, because we can, at the very least, we have a note that's in the chart and we can follow up on that and make sure that they're getting the best care.
Familiarity can also help your family pediatrician monitor long-term health during unplanned visits.
Every time they come, we get vital signs, we get weights, if they haven't had, we get their height, and so, we're able to track their growth and their development, and, that's much easier to do if we have all that data. You're building a relationship with the child and with the family. You're able to pick up on things that take time.
Another advantage Dr. Elam points out is that your child is basically seeing a specialist on every visit to a children's doctor.
Children are different. The medicines are different. Some medicines you're not supposed to use in children, and the medicines that we do use, or the dosing is different. And so there's just a lot of little nuances and details that are challenging, and so it's nice to that we're all trained for that, and even our nurse practitioners or PAs that work with us are all very well trained in that, and we work with each other all the time, so we're able to keep the best quality.
Almost be like a knee-jerk reaction when somebody in your home gets sick to just go to the urgent care, because it's usually closer and it's you can walk right in. But when you're talking about kids, the doctor that knows them best is probably the one that they're going to be most comfortable with, and is probably going to identify what's going on.
Exactly, and I like that he brought up the triage nurse that you can call even after hours. They have helped us in plenty of situations. A time that I can think of when I was ready, bag packed, to go to urgent care, and she's like, no, that actually can wait till tomorrow. Go see your pediatrician, somebody who Amira knows. So that can definitely help.
Yeah. In fact, he told me that he had just that day talked to one of his partners who was dealing with a patient who was out of town, went to an urgent care, and the parents got a million things going on, forgot about a medicine allergy, and they prescribed the medicine that the child was allergic to, so now they were working through that. So, just a lot of reasons to stick with the doctor you know best.
Exactly. Gotta love pediatrician. I still remember mine for sure.